Hey, Dr.
You good?
I forgot my name.
You'll remember it eventually.
Yeah, I've only been using it for decades. Hey, y'all. Dr. King here.
Dr. Cha.
Today we're going to be talking about this broad spectrum topic called pink eye. What is it? Is it contagious? What is it? Keep watching. We'll find out. I know. I did the what is it twice. So today we're talking about a very broad subject called pink eye. When my producer said that we were going to be talking about this today, I was like, really? Man, what are we going to do with this? That's a really broad topic. We're at least going to tackle pink eye today. So you may be wondering, what is pink eye? Well, that's actually a garden variety term that covers a whole lot of different disorders. Literally, it's describing anything that causes the eye to turn red or pink. That can be virus, bacteria, allergy, irritation. So we're going to kind of give you some general tips on what to look for and what direction you could be heading in.
No.
The most common form of pink eye, conjunctivitis is another thing to call it. The conjunctiva is literally just the white part of the eye.
Yeah. I'm trying to be a visual aid for you.
Thanks so much. Appreciate it. The conjunctiva can turn red for many reasons. The most common, I think, we probably see walking in the door is viral. A virus, such as a cold virus or something like that. You get that in the eye. It doesn't usually blow into the eye, but you touch something and touch your eye. Mm-hmm. And once you do that, you've inoculated the eye.
Yes.
And that's the most common vector for most eye infections. Mm-hmm. Is touching. So a viral pink eye, most of the time those have to run their course. There are some more serious viruses like shingles virus. Now those need to be treated. But the one where the eye is just a little pink, it's a little watery, it's just going to pretty much run its course, whether we give you something for it or not.
Right.
But there's bacterial, there's other things. Those are going to start getting more discharge. You're going to start getting goopy discharge, mucousy discharge. You might need some treatment for that. If the eye's hurting, go see your eye doctor. If your vision becomes in any way impaired, you need to get that checked out. Light sensitivity, increased light sensitivity, that needs to be checked out. What else am I missing?
I mean, pretty much covered it. You don't want to assume it's pink eye or red eye. You know, they're different shades of the same color, right? And you know, pink might just be a precursor to red. So what you can do, and it will never hurt, is just keep the eyes lubricated using an artificial tear. But you never want to, if you have like an old eye drop from something else that you fought in the past, never just assume that it's going to do the same thing, because you know different medications treat different things, and sometimes the wrong medication can make something worse.
Like pouring gasoline on a fire.
Yeah. So yeah, come let us see you. Let us make our professional judgment of how to take care of you best. Hopefully, if it is just like a viral pink eye, like a cold in the eye, you can even think of it, we'll just encourage you to the finish line.
UGLY, you don't got no alibi, you ugly.
But if it's something more serious, especially if you're like a contact lens wearer, or if you do have serious allergies, you don't really want to put it off, because treating it earlier into its disease course or its state is going to be a lot more manageable, a lot more comfortable for you down the line, versus you're trying to power through it, and then it comes in a worse state, and we might need to, you know, use the big guns.
You don't want the big guns.
No, you don't. No.
We actually have a diagnosis called CLAIR, contact lens associated red eye. So there's so many things that can cause a pink eye or a red eye that you know you do need to talk to your doctor and pick through it. It's best to see an eye doctor for that. Your primary care is great at bacterial and stuff like that, but they don't. You know, you need to look at it with a microscope and talk to your doctor about what you've been doing, what you've been exposed to, because we're going to treat an allergic reaction far different than a viral or a bacterial reaction.
Okay.
MythBusters.
Yeah,
We're gonna bust that myth.
Yeah, lively today.
I'm feeling better.
Yeah, that's good. That's good.
Okay, so the first Mythbuster is pink eye is always caused by bacterial infection. True or false?
So yeah, pink eye is not always caused by just one thing like a bacterial infection. When we think about infections, right? If you get a cut, you put Neosporin on it, right? It's an antibacterial ointment. But there are other bugs crawling around, floating in the air. It could be a virus. Think of the cold, or herpes, or even COVID. Those are viruses.
Yes, COVID can cause a pink eye.
Yeah, those are treated much different than an infection. You can't just put Neosporin in the eye expecting a viral infection to go away.
No.
So, as common as viruses are, they're actually not the most common, right? Like Dr. King was saying, viral infections are what we see more commonly. So don't assume it's a bacterial infection and grab your Neosporin.
Antibiotics only treat bacteria. There's a common misconception that you just use an antibiotic for any kind of infection. And it's like, it's gotta be bacterial, not viral, that kind of stuff.
Yeah. I mean, before I went to school, I thought, Neosporin solved everything. So that's why people
kind of like the dad off My Big Fat Greek Wedding.
Oh, right.
Windex
The
fixes
Windex.
everything. Please don't put Windex in your eyes.
Okay, the next one. Pink eye only affects children.
Pink eye does not only affect children. In fact, I mostly treat parents whose kids had a cold and they ended up with a pink eye from their kid's cold.
Yes.
Because they're wiping and then they touch.
Yes.
That's that inoculation thing I talked about. So pink eye can affect anybody at any age. It's not discriminatory.
Pink eye is highly contagious once you have it.
Contagious depends on the cause. The viral ones tend to be pretty darn contagious. There's one called epidemic keratoconjunctivitis, EKC. That, God, just look at somebody with that and you get it. Not really. Just kidding.
Yeah.
But it's usually shed in the tears or something like that. So, a good rule of thumb, any kind of redness, watery eyes, if you do anything, wash your hands. Wash your hands. Part of my treatment is we want to keep it isolated to the person who has it. And you live, so other people in the house use a separate towel. You wash your pillowcase every day so that you don't spread it from one eye to the other, just rolling over. Separate hand towel in the house, and just the general hand washing.
Yeah, I think you touched on it. How contagious some of these can be. You might just have it in one eye, and then over the next few days you develop in the other eye. Because literally, maybe you swipe across your face, and then you inoculate or kind of give yourself the infection in the other eye.
Yeah, it's not going to walk across your nose. You have to put it there.
Right.
Do you want to take pillows and farts?
Oh God, sure.
I am not.
Okay, the last one. Pillow plus farts equals pink eye.
Aye.
I mean, I thought it was real until I went to school.
I'm glad your education paid off.
Yeah, dividends, obviously. Yeah. So no, that is a myth.
We're gonna bust that.
Yeah, we're gonna bust that one.
Where did it come from? Like, who started that?
I have no idea.
Great
Probably
question.
a movie or something, I bet.
It probably
I bet it was a movie.
Probably was in media,
Yeah.
maybe some coincidental, here's what I imagine, right? Kids are at like a summer camp or something, and like the bunks are like reused, maybe not taken care of. It's not a hotel, it's not the Hilton, right? It's just like a bunk. And they're messing around, and then one kid's gonna eventually fart on a pillow. The counselor's gonna tell him, "Hey, shut up, go to sleep." And one of the kids wakes up with pink eyes. Like, you fart on my pillow. Cause me to have pink eye. That's the tall tale that's told across all the camps. And then now we're older. We have our own
blaming
kids.
summer camp for pillow plus farts equal pink eye.
Yeah, I don't know. That's my head fantasy.
Okay.
Okay.
This is gonna be my new day job.
Oh yeah, I'm ready to take it all.
I'm gonna retire. I care. I'm just gonna talk about it.
For more Days of Our Eyes content, go ahead and subscribe, like the video, interact with us, leave a comment if you have some questions.
Just drop a question in the Dropbox.
Yeah, and we'll try to get back to you with best answers that we can give you over the internet. Anything else you wanna leave it with?
Just remember to subscribe, and we'll see you next time.